to announce to the world that we're HIV positive?
Well, first of all, I think early detection actually saved my life, number one. I think that one of the most important things for me was my mind and attitude toward my new status. I never thought I was going to die. I didn't get depressed. You know, of course, in the beginning it was overwhelming and I was upset, disappointed, all of that, frustrated. But I said after that, I said, you know what? My support system kicked in, Wendy, through my parents, my brothers and sisters.
What do all of us in this room need to do to end HIV/AIDS?
If I could ask one thing of everybody here, I would say step up our game, get more involved in advocacy on the federal and state level. There are 50 million people in this country currently uninsured, including millions of people living with HIV and other chronic health conditions. This is an outrage given the fact that treatment advances have transformed HIV from a deadly disease to a manageable chronic health condition, and being in treatment, as we heard, can greatly reduce transmission of the virus. I'm just saying, if not us, who? And if we don't do it now, when is it going to happen? So now, we have to step up.
Well, you know, we have the tools to end the AIDS epidemic, but let's not get it twisted. We haven't done it yet. And for me, you know, what we all need to do is to make sure that we're prepared, that we need to have treatment on demand. We need to make sure that we're integrating both biomedical and behavioral intervention. We need to make sure that people with HIV come out and we work together to create an environment that they can come out. And like Magic says, this is our deciding moment. We need to transform our organizations so that we are prepared to get the job done in a post-healthcare reform world and in a world where biomedical interventions are more critical to the work that we do.
I always remember that I'm standing on the shoulders of some amazing people. That I'm here because Craig Harris stood up. I'm here because Brandon Moore shouted out. I'm here because Tim Offit told me that we had to fight like hell no matter what other people said. And that we're all here because of those folks who should be with us right now.
And scientists, clinicians, and affected communities should no longer be hesitant to use the words HIV cure. And this is a time when funding research towards a cure must be a top research priority.
The strategy has four main goals: to reduce new HIV infections in the United States, to increase access to care and improve health outcomes for people living with HIV, to reduce HIV-related health disparities, and to achieve a more aligned and coordinated approach to the HIV epidemic.